I'm Becky Clark. I'm a genetic counselor at Compass Oncology, and I wanted to go over two of the most common questions that I get, one being what is a genetic counselor, and then what happens in a genetic evaluation. So a genetic counselor is someone who is trained in genetics. I have a Master's of Science degree, and my focus is in the clinic to meet with patients to convey this complicated genetic information and personalize it to them and to their families. So really I'm translating this information to make it beneficial for the patient and to help the patient understand their options and make decisions about their health care. In hereditary cancers, which account for approximately 10% of all cancers, we talk about doing genetic testing to identify the risk for those individuals and families to develop a cancer. But most cancers are sporadic. So there's no hereditary cause. We all have some level of risk for cancer. The other piece of my pie here is a familial risk. And the difference is with hereditary cancer, there is a mutation. We can track it through the family. Those who don't have the mutation might be reassured about their cancer risk. But with a familial risk, we have a family history of cancer and no mutation to explain it. So I actually counsel people about the hereditary component, but also the familial component. If there's no genetic mutation to explain the cancer in the family, we might still screen people more closely just based on that family history of cancer. So I help counsel people through that and identify resources for them to obtain additional screening as it's appropriate. So obviously my focus primarily is on hereditary cancer, and that's what I want to expand on here. Remember I said about 10% of cases of cancer are hereditary. So who would be a good person to consider genetic testing? Generally, we say folks who have a young age at diagnosis for that cancer type. Usually that's under the age of 50, a younger breast cancer, colon cancer, uterine cancer. That's too young, and we wonder if there's maybe some underlying genetic reason that puts somebody at higher risk to begin with. We also look at whether or not somebody has a personal history of more than one cancer type, whether that's two cancers in the same organ, so let's say a breast cancer on both sides, or two different cancers, a colon cancer and a prostate cancer. So that would again make us more suspicious that there was a higher risk for those cancers in the first place. Individuals who have had more than 10 or more than 20 colon polyps in their lifetime are at higher risk to have a genetic mutation. And if you have a family history of multiple individuals with cancer, particularly if they're the same cancers, then we start paying closer attention. Again, all those individuals may have the same risk factor, and that could be a genetic mutation. We pay attention to rare cancer types, things like ovarian cancer, male breast cancer. Those are much less common and do have hereditary components as well. So again, we want to target those patients and their families. And of course, if we know that there's a gene mutation in the family, then it would be helpful to test family members and know whether or not they have that mutation and what their risk for cancer is based on that. So this is a very brief list. There's obviously a lot of nuance to this. But if you identify yourself on this list, you may benefit from an evaluation in our clinic. Specifically for treatment of cancer, there are a few cancer types that could benefit from identifying a genetic mutation. Breast and ovarian cancer, pancreatic cancer, and metastatic prostate cancer. They all have targeted therapies depending on the gene that might be identified. So for individuals with those cancer types, we don't pay as much attention to what's in the family or really their age at diagnosis. It's beneficial to treatment, so they get funneled through and have genetic counseling. Ideally, we test the person who has the cancer history, but if there's a family history of cancer and you are unaffected but are concerned about your own personal risk, we can certainly evaluate your risk and make recommendations for genetic testing or screening for yourself based on the family history. So what happens when you are in a genetics consultation? In a genetics visit, we hopefully prepare ahead of time and send you information to collect from your family. We want to learn about the cancers diagnosed in your family, the ages they were diagnosed, the relationship to you, and we use that to draw a family history. We talk about that through the visit. We also collect your personal medical history. If you've had cancer, it's important to know the pathology of that cancer. And then we talk about decision making, what the risk is for the family, what your options are for genetic testing, what it might mean for your treatment, for your children, for your siblings, for your family, and giving you that information to help come to a decision that's going to be best for your care. There is some counseling aspect. It is in the title after all. The counseling piece is more advisory and providing you with the information to make that decision and identifying family members and how to talk with family members. It can be complicated to share this information with families, so we do help with that aspect. When it comes to genetic testing, there are many different approaches to testing for hereditary cancer. We could target the mutation that's known in the family. If we have a suspicion for a particular syndrome based on your personal or family cancer history, we could maybe focus on that. But more and more we're testing on broader panels, and we're looking for multiple cancer risks over multiple genes and providing you this broad information about your personal risk for hereditary cancer. Some of the common questions that I get about genetic testing or hesitancy to come to the genetic counseling visit in the first place. One of those is insurance, concern about insurance covering the testing or hearing that testing is going to be too expensive. And for the most part, if you meet the criteria for testing and on our clinical recommendation, most insurance companies will cover the testing or provide financial assistance. The labs provide financial assistance for the testing, and we walk through that process during the visit, so there are no financial surprises to this. Some people are concerned about discrimination in health insurance. There are federal and Oregon state laws in place to prevent that from happening. So your health insurance cannot use this genetic information against you or your future risk of cancer based on this result against you. There are some limitations in that insurance coverage. It's not clear if, for instance, life insurance can use this information, but for the most part, folks are concerned about their health insurance support, and we should not be concerned about discrimination in that area. Some patients tell me that test results won't change their decision making, and that may very well be true, but I find that a lot of people don't know what decision making could come from a genetic test result or what it might mean for the family. I'd say in very few cases it doesn't change the care for the patient themselves because maybe they've already addressed that cancer risk because they've had cancer in that particular organ, or they've had a preventive surgery to prevent that type of cancer. But most patients do benefit from changing their screening or prevention, or at the very least providing information to their family. And so this is part of the counseling aspect for me, is walking through with patients, how is this going to benefit? And is it information that you want to know? Is it information that you feel like you would act on and are ready to pursue testing for? So what happens after we complete genetic testing? Again, part of our goal with genetic testing is to identify those who are at higher risk so we can screen more closely or prevent those cancers from happening. Usually screening means we're going to start at a younger age. We might do screening more frequently, or we might add in screening that we don't usually do. Prevention usually means preventive surgeries. Now, obviously that depends on the organ. The most common one we talk about is preventive ovarian cancer or uterine cancer risk by removing those organs. We talk about testing family members. If we know that an individual has a mutation, that means their children and their siblings have generally a 50% chance to have that mutation as well. This is something that men and women can inherit, and men and women can have cancer risks associated with these genes. And so testing family members gives those family members information about their cancer risks so they can take action on their care and give that information to their children. It also reassures the folks in the family who don't have the mutation that other family members have, because it means they don't have that higher risk for the cancer that we're seeing in the family. In some cases, we do have targeted treatment for folks with an inherited mutation and a cancer associated with that mutation. That's something that our oncologists are very aware of, and we'll talk people through the options. And the genetic testing piece is just one aspect of determining their treatment plan. So if you feel like you've identified yourself or your family as somebody potentially concerning for a hereditary cancer syndrome, or you just generally have questions about your cancer risk and what you should be doing for your screening, we have visits in all of our offices for genetic evaluation, and we can make recommendations for you or the family. Of course, we're happy to see you, to have those conversations. Even if it doesn't lead to genetic testing, we can talk through what that means for you and your family. If you'd like to learn more about those options, you can visit us at compassoncology.com.